Okay, so let's get started. Welcome everyone to our information session for our graduate programs in spatial analysis for public health. Can you hit the next slide? Okay, so today we have a few different people here to present with us. First, my name is Morgan Fredericks. I am the admissions officer for all of our Masters of Applied Science and affiliated certificate programs. We will get started by introducing the rest of the presenters today, and we will start with introducing Dr. Frank Curriero.
Hello, everybody, and thank you, Morgan. My name is Frank Curriero. I co-direct this program, the Spatial Analysis for Public Health program, with Tim Shields, who will introduce himself right after me. So let's see a little bit about me. My PhD is in statistics. I've been working in this field of spatial analysis and GIS probably for the past 20 to 30 years. And I'm a professor in the Department of Epidemiology, and I also direct the Spatial Science for Public Health Center we have here at Johns Hopkins University. I'll let my co-director Tim now introduce himself.
Hi, everybody. I am Tim Shields. I'm more of a geographer, so my graduate work was in geography, which really got me into GIS and GIS applications. And for the last 25 plus years, I guess, been doing GIS with public health applications at Hopkins. So I'm now a senior scientist in the Epi department. Excited to be part of this program. Also excited to be part of the Spatial Science Center for Public Health with Frank, where we just do all manner of spatial analysis applications across all kinds of topics within different departments across our school and university. So based from that experience, we kind of put this program together. But how about we turn it over? I don't know. Well, who's next, Morgan? Let me see how the program
And we just want to introduce our MAS graduate, Nick Rolig. So Nick, please feel free to introduce yourself.
Great, thank you. I had problems with the mute button. Hello, everyone. My name is Nick Rolig, and yes, I am a MAS graduate of this program. It was an awesome time, and look forward to hearing your success stories in the future.
Okay, sounds good. So today we will be going over some spatial analysis industry overview, program details, curriculum for our MAS and certificate program, learn a little bit about online learning and the student experience here with this program. We will highlight our awesome faculty, go over the admissions requirements for the program, touch base on financial aid and tuition, and then we'll have a little Q&A at the end, and hopefully get some of Nick's insight from his experience with the program as well.
Thank you, Morgan. So I will take it from here, and like Morgan showed in the agenda, we're just kind of give you some flavor of thoughts that we have about spatial analysis, and I'll kind of transition into specifics about our program. So we'll start off really simple. What is spatial analysis? Well, it can really depend on who you ask. Okay, it's the interpretation of the interpretation and analysis of geographic information through the use of mapping software and statistical analysis. So it builds on foundations in epidemiology and public health. And so this is focused spatial analysis for public health. That's why you see the epidemiology there. But a lot of the tools and techniques that we teach and we speak about really carry over to other disciplines. In terms of our program here, both on-site at Hopkins and also in this online program, our spatial analysis education includes components of spatial data, geographic information systems, which is GIS, and this field of spatial statistics. And this field of spatial statistics is sort of a distinguishing feature of our program because not a lot of other programs or universities out there have dedicated faculty and components in this idea of spatial statistics. So you can make the map, which is great, but then actually analyzing the map is one of the big features of our program. So, a little bit history of spatial analysis. It is thought to have started way back when, in the 1850s with the famous John Snow map of the cholera outbreak in London. And at the time, cholera was thought to be an um, airborne illness, and John Snow thought it was, or hypothesized that it was waterborne, and there was a water pump located in the town, and he mapped the cases. That's what you see here in these maps. He mapped the cases, and he showed that they were clustering around the water pump. So he removed that water pump, and the cases decreased dramatically. And that was sort of one of the first examples of using maps and spatial analysis to identify health outbreaks and health outcomes. And obviously, it turned out to be that cholera was proven to be a waterborne disease. Um, Fast forward 150 plus years, this is again maps you see, and this was a project Tim and I and others here at Hopkins were involved in. This is showing you predictive malaria risk maps, okay, of predicting malaria in Zambia, Southern Africa. And we have maps for the dry season and the rainy season. Each map not only has a risk map, but also has the shaded green map is a map of prediction uncertainty. Since we're using statistical tools, not only can we just estimate um, prevalence or risk, but we can also um, assess uncertainty or confidence intervals in that risk. So that was just sort of an example of some of the projects that Tim and I work on. Nowadays, you see maps all over the media, and it's not just in the last, 5 years. It's been more or less in the last 15 to 20 years. You're seeing a lot of different maps out there. Here's some examples. CDC's influenza surveillance reports. They got the flu view out there where they're showing you, by state, what is the prevalence of flu during the flu season. New York Times had an interesting article you know, back in 2017 about endangered species and the stuff we buy. So it was really kind of mapping out our footprint in terms of the products that we buy and how that kind of percolates back to endangered species. So it's kind of a unique take on maps and spatial analysis. And maps are really powerful, and the media knows this that maps are really an eye-catching tool to convey information, and it's sort of still that kind of sexy way to to communicate results or points you're trying to make. And that leads me into probably one of the most famous use of maps in our lifetime. Okay, and this is the COVID dashboard that Hopkins produced during the COVID pandemic. The dashboard is no longer active, um, but people can remember back during the pandemic and in the recent years following the pandemic that this was such a valuable tool that everybody looked to, and similar dashboards are out there, but everybody looked to kind of see, okay, what's going on, and it really exemplified the power of maps. And Tim and I will always tell you, maps really make you think. But the map is just one component of spatial analysis. It's sort of like just the posting of your data. And that's what you see here in the COVID dashboard. It's just showing you where cases are occurring. And this was great that it was updated once or twice a day. So you can sort of see it in a dynamic fashion like that. But there's also the component of spatial statistics that I mentioned that allows you to go beyond the map and say, now, can I analyze this map? Where are the significant clusters? Where is this thing moving? And things like that we talk about with infectious disease. So the COVID dashboard is a great example of the power of maps for communicating information to the public. So why spatial analysis? So here are some quotes from the US Department of Labor. Because the uses for geospatial technology are so widespread and diverse, like I said, it's not just public health. The market is growing at an annual rate of almost 35%. There's an increasing demand for readily available, consistent, accurate, complete, and current geographic information. And the widespread availability and use of advanced technologies offer great job opportunities for people in many different talents and educational backgrounds. So this idea about you have spatial data, geographic information, and also these advanced technologies, those are all components of of our program. Spatial analysis for public health. This was a great article that came out a few years ago. It says, what gets measured gets done. And that is such a powerful statement, because that is so true, that if there is data out there, or if there's information out there, that's what gets used, okay? Because it's already available out there. And just to take one of these quotes from the paper, that public health leaders recognize that there is an urgent need for more timely and more geographic specific data at the neighborhood level, or sometimes we call this the census tract level, which is just a small geography, like zip code is a geography. So there's more of a need for this type of neighborhood level data to efficiently and effectively address the most pressing problems in public health. I'm sorry for not reading the quote word for word. I'm just kind of throwing my own thoughts in there, but it's no longer just at the state level, right? We really want to drill down to the community level, and that's where spatial analysis really can be effective in helping solve some of the bigger public health problems we face today. Careers in public health. So there are a number of career paths, both narrowly focused and more encompassing. And we'll always talk about spatial analysis as sort of like being an added benefit. Okay, you don't have to be the statistician or the geographer, and where this spatial analysis is all that you do. It could be an added on to your career. If you wanted to have sort of a different direction in your career, having spatial analysis can be sort of that added benefit. A lot of different job opportunities out there: environmental health officer, GIS software developer, cartography, visualization specialist. So this is about making maps. Geographic information scientist, geospatial data administrator, a spatial statistician. You can go on and on, because like I said, we focus in public health, but a lot of these tools and techniques we teach go beyond, or extend to other fields than just public health. If we want to track some of our alumni, okay, so they ended up as statisticians, as GIS data analysts, epidemiologists, faculty at universities, okay, and maybe they were already the epidemiologists and the faculty, and they just kind of added spatial analysis as another weapon in their toolkit. Public sector institutions, so CDC, Department of Homeland Security. We had a student go to Public Health Institute and Tracking in California. A lot of students go to health departments or come from health departments, and again, just stay there. Utility companies, big data institutes, geospatial epidemiology consultant. These are all different types of jobs that our alumni have gone to or stayed in, and just added spatial analysis to their skill set. Applications from CDC, sustainable energy and health, oncology, global burden of disease, water, air quality. So in terms of exposure assessments, spatial analysis can play a key role. Patterns of health disease. I mean, it's kind of endless, because pretty much anything can be mapped. Any public health exposure outcome can be mapped and analyzed, and then you need the tools of spatial analysis to help you do all that. Some of our program details. So we offer both a master's and a certificate. So the Master's of Applied Science for Spatial Analysis in Public Health, it's 50.5 credits. Hopkins runs on terms, okay, not semesters. So we have 4 terms throughout the year, 2 between August and December, and another 2 between January and May. So they're 8-week terms, and so 50.5 credits for the master's degree. That's over 2 academic years. We also have a certificate, which can be done in 1 year, and that's just 18 credits. It's a lot of skill-based orientation for working professionals. That's how we look at our program. It's part-time, 100% online, and sort of our approach is this skill-oriented approach. There's projects, examples, there's hands-on learning, a lot less so than content exam. It's more working you through projects, seeing how you would actually use this stuff in the real world. And we focus on local and global issues. The goal here in our program is to prepare students to address public health problems through a multidisciplinary approach that apply the latest scientific knowledge. So the idea is you can take spatial analysis and use it in what you're currently doing as an added benefit. This is the 2-year curriculum all spelled out. I'm not going to go through every course here. This is available either on these slides or on the website for the program. But there are 4 primary spatial classes. Okay, there's a class on GIS, which introduces you to the ArcGIS or ArcPro GIS software. Okay, about how to make maps. There is a spatial class on spatial data technologies. Okay, so where do I get all this spatial data? I know how to map it. Where do I get it all? So there's different technologies on there on how to get that. So those first 2 classes tell you, okay, how to get the data, how to map it, and then we have a 3rd course on how to analyze it. So we have a course on spatial statistics, and having this dedicated course just on applied spatial statistics really is a distinguishing feature of our program. Like I said, not a lot of other programs will have faculty that are trained in statistics, like myself, to have a dedicated course on applied spatial statistics. And then the last, the 4th spatial class is, we call it spatial applications. You see it listed down there at the bottom, and that's a course where it brings it all together. So we taught some of these courses 1, 2, and 3 of the spatial classes kind of in succession about, okay, now this is how you map, this is where you get the data, this is how you analyze it. Now we kind of want to bring it all together and give you a project and have you work through the different steps of that project. There are other courses there's 2 courses in epidemiology, there's 2 courses in biostatistics, there's professional development classes, there are some labs you see thrown in there. That's just to keep your GIS skills kind of honed in through the 2 years. And then there's this integrative activity course at the very end. And this is a highlight of our program, that we allow students to bring in their own data. Okay, and you can bring this in year 1 if you're in a master's program, and you can work on a project of your choosing, whether it's something already from your work, whether it's something in your history that you were involved in, or just a different area that you're interested in. And we teach you how to go out and get the data for that, and you can bring that in and work on that as your capstone project. We call it integrative activity, but this is sort of like your thesis project for the program. So that's a highlight of our program. You're not required to bring it in. We have various data sets we supply to students that they can use for the integrative activity, but we like to have that option to allow students to bring in their own data, and that is a highlight of our program, as well as the spatial statistics course being a distinguishing feature of our program. This curriculum here, you see here, this is for the 2-year master's program. For the 18 credit certificate, you will take all of the 4 primary spatial classes in the first year, in the 1 year of your certificate program. So our classes are a mix of, they're the same classes, so they're a mix of students that are in the 1-year certificate program or in the 2-year master's program. So you get the same curriculum, spatial curriculum, whether you are a master's or a certificate seeking person. Why would you take a certificate? Well, a lot of students we get already have, so say, an MPH program, where they have background in epidemiology and biostatistics, so they don't need to take that. And then we usually offer up the certificate program for that. Online learning at the School of Public Health here, we're experts in it. We've been doing it well before the pandemic. So we have more than 20 years of experience. The courses are developed with high production value. There are online course activities to keep students engaged throughout the program. Faculties have recorded their lectures, which provide increased flexibility. You can watch these things anytime you want, although they are scheduled on a week-by-week basis. But when you watch those lectures during that week is completely up to you. The online student experience, and Nick can certainly talk about this at the end with any questions you have, but there is this thing called Course Plus, which is sort of our virtual learning management system. Okay, it's the one platform where you will go for each class. Each class will have its own Course Plus, and you can get everything about the class there. Any kind of background, some more supporting material. This is where you will listen to the lectures. There is what we call discussion forum there, where people can post questions, okay? And Tim, our teaching assistants, and all your peers in that class with you have access to see the questions or comments that you posted, and they can interact with you and reply and so forth. So Course Plus is a great tried and true method for our online learning experience. And we actually use the Course Plus for our online lecture, our excuse me, our on-site programs. PhD and master's programs, on site. Even though we see the students face to face, this is a place where everything is all organized for students to go and get. Okay, our esteemed faculty. Well, you met Tim and I already. Elizabeth Topper, who is actually the director of all of OPAL, right? Spatial Analysis is one of the programs. We're also fortunate to have not only Elizabeth, but Rosa Crum and Aruna Chandran, and together they teach a lot of the EPI classes. We're missing a picture here for the biostats person that teaches the biostat classes and so forth. So you're in good hands. What's nice about the spatial classes is you'll have Tim and I for years 1 and 2. Tim leads 2 of the classes, I lead 2 of the other classes. We share the integrative activity class. So you'll see us throughout the 2 years, or the 1 year if you're in the certificate program. We have the same TA that follows through, so you'll get to know her as well. And so it's nice to kind of have that continuity through our program. I will send it back to Morgan now to talk to you a little bit more about specifics about applying and admissions requirements and so forth.
Yep. Thank you so much, Frank. So for admission into the program, we need people who are applying to the MAS program to do their application in SOFAS. But if you are completing the certificate program, you would be doing your application in SOFAS Express. The applications are pretty similar for the most part. For both the certificate and the MAS program, students need to have completed a bachelor's degree from an accredited college or university. If you have completed a degree internationally, so outside of the US or English-speaking Canada, that degree would have to be evaluated by a credential evaluation service. We recommend using WES as a credential evaluation service to get that coursework evaluated. We would need all of the courses that you've completed in your application, so transcripts from, any type of coursework you've completed at the college level. You also need to have sufficient prior quantitative coursework. If you don't have quantitative coursework, you can show alternative evidence of quantitative ability. That could look like, performing quantitative work in your career. You can show that evidence in your resume. You can show it in your statement of purpose. And yeah, like I highlighted, you do need to upload your resume to your application. You would need a minimum of 3 letters of recommendation for the master's program and a minimum of 1 letter of recommendation for the certificate program. Now, although those are the minimum letters of recommendation, you can add more letters of recommendation, up to 5. I always suggest, if you may have an application that may have a little weak spot, like maybe you didn't do well in a couple of courses in undergrad, to add the 5 letters of recommendation. More is always better. It gives us a more of a holistic picture of your abilities. We also suggest at least one of those letters of recommendation come from a superior, a supervisor, maybe an advisor you had at college. The other letters of recommendation can come from peers or colleagues who've seen your work experience. The most important part, I would say, of the application process is the statement of purpose. The statement of purpose is really your opportunity to introduce yourself to the admissions committee. The statement of purpose definitely needs to show your understanding of the program, what your goals are, why you're looking to enroll in this program, and just kind of highlight any experience you have maybe in GIS world, public health world, things of that nature, just to showcase that you're a good fit for the program. And then again, a couple of different things we need for our international students. I already highlighted the West evaluations for all international transcripts. And then some international students may need to take a English proficiency exam. There are ways to be exempt from the exam, like if you had an undergraduate degree where the language of instruction is English, if you even completed a master's degree, language of instruction of English, any degree really. Um, if you're a resident, if you come from a certain country or graduated with a degree from a certain country. So I always suggest if you have questions about that to definitely reach out to me about that. And next slide, Frank. Okay, so we are currently accepting applications for both the master's program and certificate program. I always suggest submit your application sooner rather than later. A lot of times it takes a little bit longer than we expect, especially with getting transcripts in, getting those letters of recommendations in. So I wouldn't wait till the last minute to submit your application, but the deadline to submit the application is July 1st, 2025. And that would be for our August 25th, 2025 start date. So we have one start date in the fall of each year. But again, we are accepting applications now. If your application is submitted, we have all of your application pieces. We generally try to give a admissions decision within about 2 weeks or so. Okay, so let's talk about tuition. So the current tuition for this program is $1,374 per credit. Right now, we are offering an Opal or MES scholarship of $528 per credit. You don't have to apply for the scholarship. Every person taking the MES program or the certificate program in spatial will automatically be awarded the scholarship. The scholarship brings it down to about $846 per credit. Outside of that automatic MES scholarship, Hopkins, they do have a financial aid office that assists with kind of applying for federal financial aid. We have other different resources as well, different external scholarships that our students have previously used, a funding resource guide I can always send out. So if you're interested, you can definitely always reach out and we can chat more about different funding options. Okay, so these QR codes take you right to the application. Again, we're accepting applications now, so if you're ready, definitely start the process. This is the MAS office email, so feel free to reach out at mas-office@jhu.edu. Feel free to reach out to me and I will answer any questions about our admissions and application process. Okay. So now we can get started with our Q&A session. So Tim, did you want to get the ball rolling with that? I know we have a couple of questions in the chat. I can read them out loud if you like as well.
Sure. Yeah, but do we want to just do a straight up Q&A or do you want to maybe get some of Nick's thoughts in here too? What's the order of events for that?
Let's address the ones in the chat if they haven't been addressed already.
All right. The first one I saw was the level of prior expertise in GIS. What's required? None. No GIS experience is required for the program. We teach this in the first term, and so right out of the gate, we assume everybody has no experience. I mean, some people do come with experience, which is great, but you're not expected to have any. As Frank mentioned, we use Esri products, so ArcGIS Pro is the GIS we use. We touch on QGIS just as, just because it's freeware and it's out there too. And we do our best. We approach it just teaching the main principles and concepts of GIS. So you can apply them to any software, any GIS software. So that's why we do it that way. And whoever asked that, if I'm not giving you a full enough, response, please let me know. We can fill in whatever gaps are still there.
And chip in here.
What's that?
Oh, can I chip in here?
Yeah.
From the student perspective?
Sure.
The labs are well written and are step by step. And whenever someone has a question, the TA or an instructor is always there, and it's fantastic. Minimal experience or no experience is required.
Sure. And you actually have to actually thinking too, we've actually had questions, hey, I already have GIS experience. Do I have to take that GIS course? And I think on a rare occasion, there was a wave out of that. But honestly, even the people who took the course after already having their own GIS experience, they see the value in it because it's really, we teach it with case studies and it's all public health applications. So even if the GIS is not that novel to you at that point and you already have that experience, you're learning more of these public health concepts and applying GIS in that realm. So it was seen as very valuable, even if you already have the experience. So I'll throw that in there.
I agree as someone that had GIS experience prior to the program.
Oh, that was you too, huh?
It was not a requirement by any means. Everything was laid out very nicely, but I always learned something new with every lab. And when I had questions, everyone was there and got back to me very quickly, and that was awesome.
So there's another question about what constitutes alternative evidence of quantitative ability. This could be coursework that you've taken. This could be an undergraduate degree in math or statistics. If you're in the MAS program, there are 2 courses in biostatistics, okay, but they're graduate level courses. So we want to make sure that you have enough, you've had some math or stat in your undergraduate to be able to handle those graduate level courses in biostatistics. If you're in a certificate program, we assume you sort of have that level of expertise, the sort of entry level biostatistics classes at the graduate level. And to be a little bit more specific for those who know some statistics, we would want you to have experience in regression, including linear regression, Poisson regression, and logistic regression. And if there are further questions about, I'm not sure if the certificate program is good for me versus the 2-year MAS, again, reach out to Morgan as a start. If there are questions there that are more kind of content related, Morgan usually sends you over to Tim or I. So it's not uncommon for me to get on a quick Zoom with a prospective student or just answer questions in email about specifics about quantitative ability and so forth. So, and whether it's postgraduate or undergraduate, we can certainly accommodate that. There is no kind of credential evaluation that we go through. It's sort of just a kind of one-on-one, explain to us what you have, this is what we need, and then we make that recommendation for you.
I can answer the next few questions in
Yeah,
the chat,
sure.
Frank. Okay, so one question is, if postgraduate, should undergraduate degree undergo credential evaluation? Yes. So all of the coursework that you've ever completed needs to undergo a credential evaluation. So if you had transfer of credit courses come in and they weren't taken in the United States or English speaking Canada, those would need to be evaluated as well. Through WES ideally, but there are other credential evaluation services that Hopkins recognizes. So again, for domestic transcripts, we need all of your transcripts as well. All of those need to be sent directly to WES. For international transcripts, all of those need to be evaluated. I'm sorry, for domestic transcripts, they need to be sent directly to SOFAs. For international students and international transcripts, all of the courses that you've ever taken need to be evaluated, sent to WES, and then WES will send them to us. Next question is, am I going to have a recording of this? Yes, we are recording this meeting. I will email it to everyone who is registered for this call. So you will definitely get an email with this recording. Next question is, professional recommendation letter sufficient? Yeah, definitely professional recommendation letters are sufficient. All of your letters of recommendation can be professional. Ideally, they would either be professional or from your academic career. So all of them being professional, totally fine. At least one of them should be like a supervisor, a manager, and that can be in a professional setting as well. Next question, is it possible to do a dual degree in the program and the MPH, or to combine the MPH with the spatial analysis certificate? So no, it is not possible at this moment to do a dual degree. You can complete the MPH and then later do a spatial analysis certificate.
And we've had a lot of those, a lot of MPH students, not an MPH at Hopkins, but an MPH somewhere else, and then they come and do the certificate for a year.
If I can chip in here as well. So in another life, many years ago, I actually got my Master's in Public Health from the University of Arizona. And I decided to actually go through the master's degree program, Master's of Applied Science and Spatial Analysis. So it's also possible to do that as well. And it's valuable.
Mm-hmm. Thank you, Nick. How does the MAS in spatial analysis compare to the curriculum and career outlook of a more general degree such as MPH? Well, it's more general. The MPH is definitely more general, and the spatial is obviously focused on spatial analysis. A lot of the EPI and the biostat classes are similar between the two programs. In the MPH, you may have the option to take one or two of the spatial classes. I don't think you can take the entire sequence of spatial classes unless it's the MPH on site. The Hopkins MPH has an internet part-time MPH as well. But they're two different degrees. There's certainly overlap between them, but the spatial analysis is really focused. And I think in terms of career, it's hard for me to judge whether or not there is more demand out there for something specific like spatial analysis skills versus something more general like an MPH. Both have public health skills. So I probably lean towards the spatial as being a little bit more competitive out in the field, because maybe that's something new that is in the application pool that other more general MPHs don't have. I don't know if Tim or Nick. Yeah, go ahead, Nick.
Yeah, so I actually graduated with my MPH from Arizona, I think back in 2016, 2018, somewhere in that ballpark. And I just graduated with MAS this year in May. The reason why I decided to get the MAS was for exactly what Frank was saying in terms of the technical skills. And I found in the workforce that I could leverage that to land more interviews, things like that. And it's definitely skill. I learned skills that are definitely in my toolkit now that I use or can use whenever need be.
Great. Thank you, Nick. Morgan, you want to take this next one about the Opal Scholarship?
Yep. So question is definitely interested in finding some extra funding besides the Opal Scholarship, but I'm not sure if scholarships also finance certificate programs or are they only reserved for full programs. So it really just depends on the type of external scholarship that you're looking for, on whether it funds certificate programs or only, full degree programs. Here, the MAS or Opal Scholarship that completely funds both our MAS and certificate programs. I also did see another funding question, any different fee or scholarships for LMICS. Not sure what that acronym stands for, but
Low to middle income countries.
Gotcha. So from Hopkins, there are not any scholarships for this program for that demographic, but we do have a list of external scholarships, which I am sending in the chat. So this link is a funding resource guide for external scholarships. The external scholarships have different criteria. Some kind of do different populations, different countries, different ethnicities. So I always suggest that applicants look and scour this list because the scholarship provides a list the link provides a list of scholarships that students have already used at the university. So I would definitely check it out.
Thank you, Morgan. I'll take these next two, and then I see we have one specific for Nick, which is great. So can and do students in this program go on to pursue, other degrees, PhD degrees, whether it's in epi or other public health fields? The answer is yes, they can and they have. Okay, we currently do have students now applying. Tim and I are writing letters of recommendation, so that is certainly an option. Any programming skills required? Like Tim mentioned, no prior experience in GIS is required. When we get to spatial statistics, we don't work within GIS. We work in R. I don't know if anybody's heard of R. It's a statistical programming language similar to Stata, SAS, and other things out there. We provide you training in R and give you a lot of the code to run some of the analysis when you first getting started in the analysis. So prior programming skills not required. If you have that, that's certainly helpful. Nick, I'll let you grab this one.
Sure. So thank you for the question. So a little bit about me. During the program, I worked full time and managed to maintain pretty good grades throughout the program. And so that was good. Now, during that time, I maintained a job for a tribal health authority, and I'm still here at the tribal health authority. And I've been able to, well, through, I guess you would say, my little small population that I work with, I have access to a lot of data. And so now I have the tools to spatially analyze data when I can correlate it with Latin long or other spatial data. So beyond that, I'm actually going on to more schooling, trying to get as many degrees as possible, and studying computer programming at a local community college. So then I can later apply to a doctoral program. And I hope to leverage what I learned in the spatial analysis program to go on and do more health informatics at a with excuse me, spatial emphasis.
Great, thank you, Nick. Let's see, there's one here about could you speak to the potential of intersections between spatial analysis and health equity, planetary health, climate resiliency, planning for health systems, all these other areas of expertise. Definitely spatial analysis can play a role. Okay, and you'll see more how that can play a role once you're in the program. Tim and I are not the experts in climate, planetary health, health equity, disparities, all these kind of things. But you can definitely apply it across those. And when you're a student here at Hopkins, there are plenty of seminars going on that you can go and attend. A lot of them have Zoom links still now. So that's not to be a worry of learning remotely. So there's a lot of options available to you when you're in the program, whether it's a certificate or MAS, for you to reach out and participate in other departmental programs. We're a school of public health, but there's an Earth and Planetary Sciences department over at the general JHU campus, okay, which you will have access to if you want. And also, this is a great opportunity if you come in with interest or skills in climate or health equity and so forth. This is where you can focus your integrative activity in that area and really see how it can be applied across these different disciplines. The program appears to be closely related to infectious disease and environmental health. That's true, but not just those. It could be, behaviors. It could be health policy. It could be chronic diseases. Could it be also utilized in developing various community health policies? Of course, such as those for health promotion and or chronic disease. So I guess I should have read through all because it includes everything else I was saying. So, a strong yes to this. And again, having your integrative activity could be focused in one of these more community-based programs that you speak about. So certainly a yes there.
Yeah, and Frank, maybe just to dovetail on those last two questions, we really focus on the application of these skills, right? So like building out your toolkit. And while we give, public health examples a lot more infectious disease based, but there's, food deserts and other things we do. Part of another aspect of this whole program are all the students who come generally have some kind of background or interest in some realm of public health, and that runs the gamut. That spans a big spectrum there. So we try to leverage that. We try to get very collaborative and have students share their experience, and because people come and they want these tools and they want to apply them, and then we want to highlight that and work off each other. So throughout this, students work with each other on coursework and beyond. But for us, the thrilling part is when students come back and not just asking questions about what the homework is or the case study is, but hey, how can I apply this at my workplace or this other interest I have? And watching this get, put to those directions is the exciting part for us. So it's like limitless, how many angles this can go. So we just try to have a platform where all this can be shared throughout the whole program.
Nick, did you want to add something to that? I saw you raise your hand.
Yeah, I can talk about my integrative activity briefly. Yeah, as I said, I work for a small tribal health authority with a small population, and I looked at flooding. So I found a model that was used by another graduate student and published in the literature using Esri products, functions within there. And then I was able to basically collect rainfall data and run some statistical analysis, forecasting or interpolation, to map out where I did not have rainfall data collected. And then I was able to apply that layer to the ArcGIS model to try to attempt to predict flooding. Now, this is not a hydrology degree by any means. I took it to the next level and than I think what was expected. But the program was flexible enough. It provided guidance for me to do what I wanted to do, and was able to get some pretty cool results.
Are academic grades required for applying? Yes, they are. I think they come over as part of your transcript, and people usually list their GPAs in their CVs. That runs through the chat questions. Let us know if we missed one of the chat questions. If you have other questions, please feel free now just to unmute yourself and ask a question. Anybody?
Well, I was going to say maybe we could talk a little bit more how how a student would, like, maybe I ask Nick the question, like, how did you find your time management, or how did you manage the coursework with keeping your other professional and personal life going the way you want? How challenging was that?
Very manageable. Because the degree is part-time, I was able to maintain my full-time job and excel here locally. We're building a public health department within the community, and also maintain pretty good marks in the class. I can't say that it was a struggle. It was manageable, but it did take time and effort, right? So nothing that you could back burner. Had to pay attention.
So, Nick, I'm sure there are a lot of programs out there, or maybe not a lot. Maybe you can speak to this a little bit. When you were looking at programs and you're deciding on spatial analysis, what were some of the features that landed you in Hopkins and applying to this program?
Sure. So a few years ago, I was a Peace Corps volunteer over in Zambia before COVID-19, and was evacuated during COVID. And I was doing surveys of schools to find out if they were instituting a specific curriculum. But the point is that at the very beginning, I received a list of schools, the names, the principals of the schools, and their phone numbers. I had no idea where the schools were located, and some were actually 40 miles into the bush. So I took it upon myself to do Latin long and did a bunch of pins on a map. And then I'm going like, hey, this is actually really useful in public health. So that I started to look into spatial analysis and GIS related programs within public health. And lo and behold, I found this program, and I'm glad I did. I hope that answers your question.
Yeah, sure. Hey, can you comment on, you know, how the program is presented? You know, maybe through the Course Plus system and all that. I know you're able to manage it well, but maybe you can provide a little bit more specifics, insight into how the courses were presented to the students, and mainly the Course Plus website.
Yeah, so they can be asynchronous at self-paced. I mean, you have different milestones and deadlines that you have to meet, but then there's also the opportunity to collaborate through live talks, which are sessions scheduled far in advance throughout the course that yourself or Tim held talks, and maybe with other instructors too, that were able to hold talks, and you can come together and collaborate. The discussion boards are very lively and active, and great place to exchange ideas. We also, I think you say alumni or the current students sort of foster a cohort connection, if you will, to work through assignments or ask questions about their projects or different works. So when I was doing my projects, I'd have questions, and other people would be able to exchange ideas, that kind of thing. Very collaborative, even though it's online.
Yeah, thanks, Nick. I know cohorts in the past have had put face groups out there, so students can get together. Nick, you also mentioned live talks. Thank you for that. I forget to mention that during my presentation. So each class has a series of 2 to 4 live talks where the professors will get on Zoom calls just like we are now. So Tim will hold live talks during his spatial classes. I will hold them during mine. A lot of times they are just open-ended, like, hey, what's going on? What do you have questions about? And we kind of have this kind of back and forth interaction. Sometimes live talks also include sort of a formal process of, hey, let's work through this assignment. Okay, and kind of show you where we're thinking about that. That will take up maybe 15 or 20 minutes, and the live talks go for about an hour. And then we open, like I said, we open it up so that students can communicate. They're also recorded too. Okay, so everything is recorded and posted back on Course Plus. Yeah, go ahead, Nick.
And then I will say that the TA for this program, if it's still the same TA, is awesome. She has the ability to make herself available to do one-on-one sessions, so that you can succeed, and very helpful.
Yeah, so Kara Weisgram was the TA that you had, Nick, and she will continue to be the TA for the next foreseeable future. So, which is great news for us. Beckett, I think you had your hand raised. Go ahead.
Hi, thanks so much. This has been really helpful. Trying to figure out how to articulate my question. So I'm curious about the tools and skills provided in the program that might equip someone to sort of use spatial analysis for public health in the context of a traditional health system or healthcare delivery. I think for a little background, I currently work at UCLA Health. I lead our climate resilience and environmental justice strategies for the health system. There's a huge need, I think, for some integration, especially in my mind, some of the public health, like geospatial data, especially to address social drivers of health and other sort of environmental related factors. But that doesn't happen very much in traditional healthcare delivery or health systems, often siloed out into public health departments. And so I'm just wondering if any of you could speak to either if you've seen sort of successful integration of the work of some of your alumni in traditional health system contexts being utilized to some sort of measurable effect.
Yeah, again, a definite yes. I know hospitals have a lot of their their electronic health record systems and catchment areas. I'm involved in cancer research for catchment areas around hospitals and where, for example, screening or other preventative measures can be placed. Maps play a key role in just to start out like, well, where is the burden? And then if you want to analyze what are the factors that contribute to the burden, that's where the field of spatial statistics comes in. But the maps alone are great at generating hypotheses about information coming out of health systems that then we could follow up in spatial analysis to address. I don't know if Tim or Nick has anything they want to add to that.
I kind of blend some of my other students from the non-Opal courses with this, but I know one of them from school nursing helped to write a paper on the social determinants of health in community health and from a nurse perspectives and stuff. And it's kind of our process of getting this kind of data connected to our research. That's kind of a general comment there.
For my line of work, I work for a small population, tribal health population, and the location of the community is everything. If people are within the property or the polygon of the community, they are considered part of the catchment area. If they are outside of it, they are not. And so leveraging some of the concepts covered in the degree is very useful in my current work, and I can definitely see it being applied in the future of a lot of Native American, Alaska Native health.
Great, thanks, Nick. Beckett, I hope that addressed some of your questions.
Yes, thank you.
You're welcome. Ismail, I see you have your hand raised.
Yes, thank you, Frank. Well, just a little bit of background about myself. I'm based in Mexico, and I currently work for a global road safety program as a technical advisor for road injury surveillance in Mexico and Brazil. And of course, we handle spatial data almost on a daily basis. And a lot of this data come with a lot of issues, quality issues, a lot of underreporting. And so it's always a challenge to sort of like analyze this data and sort of find meaningful things to have as conclusions from this data when we do analysis. And of course, they're very descriptive. Nothing. I'm very interested in the spatial statistics component of the program that you were talking about, Frank, to give it a little bit of more punch to those analysis. But I was wondering if for the project, like the thesis kind of that you were talking about, if you've had students in the past that have worked on projects where they use this data with a lot of quality issues, and if they've successfully done so, or if it's a requirement to use sort of like high quality data. That's my question. Thanks.
I think it's been a mix. Obviously, injury. We've had injury surveillance before. Tim can probably have better memory than me. I think we recently had somebody that actually did or had access to traffic related injuries, similar to some of the stuff that you were talking about.
Yeah, it's kind of a current thing. The one comment I would say too is how this has evolved over time is, we had a GIS class, and for that, here's a case study, here's instructions on how you do your GIS functions, here's some data, and then here, answer these questions with it. And what became a concern was that was too tidy of a package to hand off because of the data quality issues. So it's because of reasons that you've stated yourself there that we kind of developed the second course, Spatial Data Technologies. We really pause and focus on spatial data, the ins and outs of it, and all the reformatting. It's always about you're creating it, collecting it, obtaining it, and in each of those processes, there's a whole bunch of issues embedded there. So the whole second course in the sequence stops to drill down on those issues to make it manageable. So how do I manage it? How am I going to have to reformat this? How am I going to find other data to fill these holes? So that's basically the main thrust of the second course in the sequence there.
And I know you asked if you can bring this data in as your integrative activity. Answer is certainly yes. This is the data you're working with in your real life. This is real-time data, and if it comes with a lot of quality issues, okay, we'll try to address some of them. That's not going to be the focus of your spatial integrative activity to focus on the quality, unless the quality varies spatially, which is a kind of interesting question. So it depends on where you're looking in terms of the quality of the data. But generally speaking, we will use your data as best we can to follow through with some of the objectives that you have in your current job. I know, Nick, you wanted to add to that as well.
Yeah, and the beauty of the program is that the integrative activity already has pre-built data sets that can be used if your data is not in the form it needs to be at the deadlines that the program has on record. So if you're working with your data throughout the program, that's fantastic and that's great. That's sort of what I did, but I always knew I had a fallback option with existing data sets. I don't know, Frank or Tim, if you'd like to talk about those pre-made projects.
Yeah, that's a good point in general, Nick. Thanks again for mentioning that. A lot of students come in with the ambition, yeah, I have my own data set. This is going to be great to work on. And then for whatever reasons, and there's several reasons, it no longer becomes feasible. They couldn't get all the data they thought they were able to get. Maybe it turned out not to be sufficient enough in terms of sample size and geographic extent to make it worthwhile. But then we have these fallback examples. We have an air pollution in California example. We have a food desert mapping application. We have a general area level health measurements where you can download different types of chronic diseases at a community level, census tract level. I think it was in Texas, and analyze that at the census tract or county level. I can't remember. So we have several of these examples, and we add to them throughout the year to give students a variety of these different projects to choose from. So in those projects, we have the data already there, or we know where to send you to go get it, okay, which is part of the tasks involved in your integrative activity. And then we give you sort of these questions or objectives to answer with that data. So those are always there. And Nick mentioned about working through the program. So if you're in the 2-year MAS, which is the only part that has the integrative activity, you start thinking about this integrative activity at the end of year 1. Okay, and then we encourage you to work through it over the summertime in terms of maybe collecting the data. There are certain assignments that will be involved with that data, like doing a lit review on it and posing some interesting questions that can be answered with spatial analysis. So even after getting through all that, okay, if you realize at some point, you know what, it's not going to work out for me to work on what I originally thought on, then you can transition to one of these designed projects that we already have available. Other questions or comments? These have been great questions. Okay, I know we're at the hour, Morgan. Maybe just to reemphasize that, please reach out to you as a start with questions about the program. And if they're more content related, either about GIS or spatial statistics, Morgan will quickly transition you to Tim or I to speak directly with.
Yep, absolutely. Thank you all for attending. A special thanks to Nick for joining us today and sharing a little bit of our experience. As always, thank you, Frank and Tim, as well, for chatting more about our program. Like Frank mentioned, feel free to reach out to me if you have any questions. I will get you to the right place. If you want to talk to one of our current students or alumni, we can get you to do that. If you want to talk a little bit more with Frank and Tim, I can help you set up an appointment with them as well. So thank you everyone for attending our call today. Have a great rest of the day.
Thanks, everybody.